Welcome back to Holistic Dentistry 101. Today we're going to talk about alternatives to root canal. Many of you know that you've gone to the dentist with a toothache and the dentist took an x-ray and told you, unfortunately you're going to need a root canal, a post, and a crown. Well, we have some great solutions where we can keep the tooth alive because we're concerned that root canals often spread anaerobic bacteria. Those are bacteria that live without oxygen in a dead root canal. And in my opinion, at least half of the root canals are not needed and can be treated with alternatives. Many people say, well, what is the alternative to a root canal? Well, basically it is to keep the tooth alive. And if the dentist goes in with a preconceived notion that that tooth's going to need a root canal, you can bet that's what you're going to get. So by choosing a holistic dentist, we're going to go in and try to do the least invasive thing possible. And what we do is we can clean out the decay and put in an herbal, specially developed herbal filling which will keep the tooth alive and let it calm down. And then in a few months you come back, have a porcelain filling put in, it looks beautiful, there's no metal, no mercury, and the tooth looks like a virgin tooth, and you keep the original tooth alive the rest of your life. That's our goal. The problem with the root canal is not all root canals are infected, but many that are have bacteria living in there even after the nerve has been removed. If you put a tooth under a microscope, there are thousands of little microtubules where these anaerobic bacteria can hide, and they don't necessarily ever show up on an x-ray. But what will happen is, and how do you know if that root canal is infected, is if you have like a fistula, like a pimple over the tooth, or discomfort after the root canal is done. And when they take an x-ray, they see a dark area at the end of the root. Even though it may not hurt, and your dentist would say, let's just watch it, why are they watching an infection in your body? If you had an infection in your kidney or your liver, would the doctor say, let's just watch this infection grow? Well, if you have an infected root canal, why is the dentist telling you we're just going to watch this infection spread? Because it's been implicated that the anaerobic bacteria that live in the dead root canal travel, the toxins from the bacteria will travel into your heart. It can also cause babies with low birth weight from their mothers and other respiratory conditions from the infections. So if you have an infected root canal, the only solution is to extract that tooth, and we do what's called a cavitation, where we scrape the socket very clean. Every dentist should do this, but many unfortunately do not. So next time you have a toothache, we suggest you contact the Holistic Dental Association, and they will give you alternative dentists in your area who practice in the ways that I'm talking about. Thank you.